Lovely.
Hey, Paul, it's just Deb. We've opened it up for people to come in now, so people will start coming in.
Okay. Yep.
Morning, Helen.
Good morning, everyone.
Just got a few minutes before we start. We're just letting people in, and we'll see
Fantastic.
how we go.
So exciting.
Good morning for those who've joined us. We'll be starting really shortly. We're just waiting for a few more people to join the room. So thanks for being with us today. Just waiting for a few more people to join and we'll get started in a couple of minutes. Thank you. I think I'm going to get us started because we've only got an hour and the numbers are continuing to go up. So I'll get through the first little bit of this, I think, if that's okay with everybody. So we'll stop the video that you've been watching while you've been waiting, and we'll commence proceedings. I'd like to begin by acknowledging on behalf of our partners, the Tri-Peaks, the land on which we're living and working, the Wurundjeri Nation, the Great Kulin Nation. I'd like to acknowledge elders past and present, Aboriginal people with us today, and that this is and will always be beautiful Aboriginal land. So, welcome to today's webinar, the first in the 2023 Tri-Peaks Webinar Innovation Series. The Tri-Peaks Partnership has been funded for another 2 years by the Department of Families, Fairness and Housing, that is DFFH, and the Department of Health, DH. The Centre, the Victorian Alcohol and Drug Association and the Victorian Healthcare Association are proud to continue the cross-sector initiative to support integrated support across the child and family sector, the alcohol and other drug and community health sectors. So we feel very proud to be able to continue that partnership. We encourage you to get involved in upcoming activities, webinar, mentoring program, and the collaboration and capacity building workshops and roundtables. I especially want to thank Helen Skouturis, who's here today, the head of Monash University's Health and Social Care Unit, for bringing Emily Munro out to Australia and giving the Centre the opportunity to host this webinar with Emily. But I also want to acknowledge today, it wouldn't be, it's an important day today. Today, on International Women's Day, I would love to imagine a gender equal world in our future, a world free of bias, stereotypes and discrimination, and a world that's diverse, equitable and inclusive, a world where different is valued and celebrated. Together, we can forge women's equality collectively if we can all embrace equity. I'd like to acknowledge all the young women and young children in care. I'd like to acknowledge all the big aunties. I'd like to acknowledge all the grandmothers, all the mothers, all the women across all of the human services sector that I get to work with, and women that are with us today for all their incredible work that is really meaningful and changes people's lives. So thank you. Enough from me. I'd like now to welcome Paul McDonald, who's currently the Chief Executive Officer of Anglicare Victoria, the state's largest provider of foster care, family support and youth support, and the inaugural and only founding chair of our national homestretch achievements and campaign. So over to you, Paul, to get us started.
Hey, thanks, Deb, and hi everyone. I hope you can hear me. Thumbs up. Yeah, good, great. Okay, so we're wired for sound. So fantastic to see you all again at the Tri-Peaks. I love this joint, the Tri-Peaks. It's fantastic, bringing the health and welfare and arms of all across the, the human services, health and human services, to important areas of topic and discussion and debate. And, it's my privilege to introduce Professor Emily Munro, who's in the country, to talk with you about such an important topic, and that being the health and well-being of those young people transitioning from care. And you remember, you saw my good self giving an opening, or was it the inaugural? Who knows what that was, Deb? But the webinar in relation to the Tri-Peaks on the campaign of Homestretch, and I'm proud and just so rapt to have this audience who really backed this reform in through your own contribution by getting up Homestretch reform, extended care through to 21 in 8 states and territories right around the country. Every state and territory now has formal care through to 21. It was never the silver bullet, but it had to be the foundation we had to build, doesn't it? It's like, driving across the West Gate and stopping 3/4 away and said, you can, and government saying you can make your own way to the other part of, like, what the hell? We're put in that platform collectively, yourselves, your campaigning, your advocacy, we've put in that platform. Whilst we've got the foundation, still the issues of housing and health will still abound for this target group. And it's so important that to have presentations by Professor Emily Munro being a part of that, because we know that young people in care, particularly in out-of-home care, 5 times more likely to have a mental illness, for example, if we'd like to put it on like that, 5 times more likely to be hospitalised for their mental health. We also know that they're overrepresented in emergency hospital queues and departments right around our hospital network. We know that because certainly we've costed that they're overrepresented there. And we also know the housing significant needs for many of those who are going to be moving into transitional care up to care to 21, what that requires. But I'm pleased to say that probably, and I'm bolshy enough to say that I think Victoria's setup is a world-leading setup of where extended care could go. The money follows the child. It's care for universal. You just didn't have to be in one part of the care system to receive extended care in this state and around the country. West Australia, Queensland, and New South Wales have all followed this, and South Australia all followed the Victorian universal view. So you could be in care and residential, home-based, in kinship, foster, permanent care, or you can deal yourself in if you're homeless. You will be resourced by the state to 21. But what are sort of the resources that we need to develop are still an issue. Housing, good stock for this group, good health care for this group, good mental health access. And so with that sort of, I suppose, sort of basis and of our current new reformed environment and the places that we still need to go to, I want to welcome Professor Emily Munro, and also say she was sort of, some of her research was sort of found fundamental to the Homestretch development. And by the way, Deb, if you don't mind, I'm going to put in a free pitch, a bit of a pitch of the symposium. Then where are we in this country and in this state with extended care? Will be held on June the 15th and 16th this year in Melbourne too, of course, Mecca of the Homestretch in Melbourne at the Park High, nice and flash, so you'll get a nice morning tea and lunch. So sign yourself up to the symposium there. Contact Irina in the office if you're interested in coming along for the 15th, 16th. We'll have every government in Australia represented and speaking on their policies and what they're doing. We've got a fantastic Indigenous panel, which Arnie Munro will be attending, and also John from ABSEC up in New South Wales and Yorganop in Western Australia. We've got young people speaking. We've got Professor Mark Courtney is going to, and Professor Phil Mendez. So far, there's more to be announced, but anyway, it's looking good. Across to Emily, and Emily sort of actually attended Australia's first symposium and spoke on the importance of extended care. And I want to acknowledge not only her research, but also her experience here in addressing the webinar. She's currently Director of the Institute of Applied Social Research, Director of the Tilda Goldberg Centre for Social Work and Social Care at the University of Bedfordshire, and Also, that institute is one of the largest research in social welfare practice in the UK and has a track record for conducting world-leading internationally excellent research. In the last 20 years, Professor Munro has undertaken an extensive body of research on young people's pathways through and out of care, including research on the implementation of the Children Leaving Care Act and the first evaluation, you'll be familiar with this, of Staying Put, which was the UK extended foster care arrangement. The extension of foster care is being described as Staying Put there in England. She is founding member and former chair of the International Research Network on Transitions to Adulthood, which has over 250 members from 40 plus countries. And if you're interested, it's a bloody cracker of a group to be involved. It's called Interact, if you want to put that into your search engine. And co-edited Young People's Transitions from Care to Adulthood, International Research and Practice. I know Helen's been looking after her while she's here. She's here only for 2 weeks. I think she's flying out later in the week. Please make welcome Professor Emily Munro.
Thanks, Paul. It's fantastic to be here and to be speaking on International Women's Day. So today I'm going to present some of the research that we've undertaken, which is really thinking about young people's transitions from care and particularly health and well-being. So if we can move on. I often start with this quote, which is from the Association of Directors of Children's Services, which really speaks to the fact care is never an end in itself. It's always just one stage of a child's journey into adulthood. The true outcome measure for care must relate to the quality of adult life that young people achieve. And Professor Ian Sinclair often speaks of leaving care as the Achilles heel of the system. If you don't get this critical transitional phase right, you can undo the good you've done while young people have been in the care of the system. And internationally, as I say, I'm part of a global network which is now over 40 countries, and the international messages around outcomes for this group are stark in terms of the risk of poor outcomes and social exclusion, low educational attainment and unemployment, poverty, mental ill health, social isolation, homelessness and involvement in crime, which is why measures like Homestretch are so fundamental. These issues aren't impervious to intervention, and we can work to implement measures which really seek to address these challenging outcomes. So recent research in England really speaks of the disadvantage this group face. So we've recently had an independent review of children's social care, and the chair of that review highlights the disadvantage faced by the care experience community is really a civil rights issue. The findings are stark. So adults who spent time in care as children were 70% more likely to die prematurely than those who didn't. And the findings really highlight the persistence of inequalities in health, education and employment over the life course, really highlighting the importance of measures which really seek to support young people in a critical transitional phase. And remedying those issues around poor mental ill health is one of the kind of fundamental foundations to start to address those inequalities and improve outcomes. So one of the challenges that we identified in our early work around young people's outcomes and transitions from care to adulthood is that we expect this group to negotiate accelerated and compressed transitions. So we expect them to make multiple changes in their life at a much younger age than their peers in the general population, and without the levels of support, both practical, emotional and financial, that other young people receive from their families. So the withdrawal of support and sometimes the loss of a home produce a new set of problems for young people that are often glossed over in euphemistic talk about independent living. Young people in normal families do not become independent at a stroke, and dependency in some areas, such as finance, continues long after emotional maturity and adult competence. And there's a real recognition of the importance of moving towards more extended and gradual or graduated transitions, which the Homestretch is really helpful in terms of thinking about longer term support up to 21 and beyond. And one of the additional challenges is actually, and I think COVID really taught us this, making multiple changes in your life simultaneously is really hard, and it's much easier to manage change sequentially. But we expect young people leaving care to negotiate multiple transitions. So they're expected to leave foster care or residential care and move to independent or semi-independent living arrangements at a younger age. They're also simultaneously negotiating the transition from education to employment, training, or to NEET status. In parallel, they're experiencing changes in workers and support. So the move from our looked after children or out of home care teams to the leaving care team, and the changes in worker that entails. And in a health context, those young people who receive support from child and adolescent mental health services are often moved to adult orientated systems, or certainly in the UK, due to different thresholds for provision, some cease to receive mental health support at all. So really challenging context for this group of young people if we don't intervene and improve policies and practices. So the direction of travel, in theory, certainly in England, has been to move away from accelerated and compressed transitions and those multiple simultaneous changes which take place at a younger age and with less support, and to move towards these more extended and gradual transitions. It's work in progress, so I hope there's learning from the UK experience which can be applied as you move into the implementation phase of Homestretch. So just give you a flavour of the legislative framework and context. In England, we've had targeted legislation which applies across the country since the Children Leaving Care Act in 2000. And over time, we've increased the duties that local authorities have to support children and young people into early adulthood. And so we now have the role of the personal advisor who supports young people leaving care to plan for their futures, and access to support from those professionals up to the age of 25. Local authorities have been required to provide support via Staying Put, which is our extended foster care up to 21 since 2014. They also publish their local offer to care leavers, which includes the legal entitlements from the legislative framework, but also identifies the discretionary support that some local authorities offer above and beyond that. We have leaving care grants to help young people finish their home, bursaries for those attending university, and we've recently been piloting Staying Close, which provides enhanced support for young people who've been living in children's homes, who have to leave those homes at 18, but that really enhanced package of support is really helpful in terms of aiming to improve outcomes for those leaving children's homes. I also just wanted to signpost to the recognition in the UN guidelines for the alternative care of children of the importance and state responsibilities towards this group. So there's the recognition of the importance of preparation and planning so that young people are equipped with the skills they need for independence. A focus on the process of transition, taking into account young people's gender, age, maturity and circumstances, and the critical need for aftercare support into adulthood. So I'm going to present some of the findings from our Care Leavers and COVID-19 study and speak particularly around health, but there are also wider findings about education and employment and training, and also the experiences and relational connections that young people experienced and the support they were provided with by leaving care teams in the context of COVID. So before I speak to the details of the study, I think it's worth kind of highlighting that some of the challenges and issues predate COVID, and that there were a range of care gaps that existed for this group. So the high risk of poor outcomes that I've spoken to, but also the importance of recognising that care leavers aren't all the same. They're not a homogenous group, and there are dangers in the way that we speak about the risk of poor outcomes, and that being a deficit discourse which suggests they're doomed for failure, rather than recognising the huge amount of success that they achieve, often in spite of the systems, and the importance and role that we have in terms of providing frameworks that allow them to be their best possible selves. So we know that this group have experienced pre-care adversities. There's been a disruption of parenting, and also once children enter out-of-home care, the parenting tasks chopped up between multiple people, which can mean that there's a real lack of continuity of care and relationship, which presents real challenges. Young people have often experienced discontinuities in schooling and healthcare provision as a result of placement moves and changes. And I think, as Roger Bullock says, successful corporate parenting is more likely to require something extra rather than something different. So it's not about the bureaucracy, it's about the relational connections and the support, recognising the experiences young people have faced. And one of the recurring messages from research, sadly over 20 years, has been that often there's a mismatch between the services and support that is available, often time limited and practical, and what young people say they want and need, and the importance of that emotional support. So the Care Leavers and COVID study really aimed to understand how COVID-19 impacted on care leavers' lives, and to understand more about how the pandemic had intensified the pressures facing this group. So we were interested in the timing of young people's pathways out of care, where they went, the services and support they received, and how they got on. So I will spare you a lot of the methodology, but the high level is we engaged with 17 of the 152 local authorities. In England, we undertook interviews with leaving care managers, with health and social care leads, importantly with young people and their leaving care personal advisors. And we also brought together the management information system data that local authorities hold on young people and their in-care experiences, and linking that with their transition pathways. The other thing that I think was really important for this study is we established a networked learning community which brought together care experienced young people, frontline professionals and strategic managers to really understand and support us in the development of tools that were meaningful for practice. So the impact of COVID on relationships and isolation. So trusting and caring relationships are at the heart of everything we do and matter deeply to young people leaving care, and have a really important part to play in their quality of life and well-being. In the context of COVID, there were some young people who really benefited from a strengthening of those relationships, a real sense of being part of the family and having had a secure, stable base, and actually being able to spend more quality time with their families. For others, however, there was a sense of strained relationships, which often precipitated unplanned placement moves. And sadly, for some young people who've been in long-term stable placements, concerns about not following COVID guidelines or the health and well-being of carers meant that they suddenly experienced a move to semi-independent arrangements, which really highlights the fragility, if you like, of some of what were seen as permanent long-term stable placements. One of the other kind of recurring messages was that actually isolation was the norm pre-COVID and was further exacerbated during the pandemic. So as one leaving care manager said, it's quite interesting that when you start talking to some of our young people, some will say to you, you know what, that is my life, that's what my life has been. I've been in isolation, I've been different, I've had to deal with these issues, things on my own in the past. Yes, I have a social worker, yes, I've had a personal advisor, but I've always had to make do, and I've always felt alone. More positively, there were some really lovely messages about the importance of supported lodgings and host families and feeling part of the family in those contexts. So in terms of, I think Paul spoke to this earlier, there's a high prevalence of mental ill health amongst looked after children and much higher than the general population. And also mental health needs often escalate at the point of transitions. So care leavers needs can increase at the transition point, and this is a flashpoint for worsening mental ill health. And work by Core and Voice really highlighted that actually 1 in 4 care leavers reported low life satisfaction during COVID compared to just 3% of the general population. So, as I mentioned, many of these challenges are ones that predate COVID. So some of the key barriers to accessing support are highlighted below. So our pathway planning process, which is in turn is intended to help think through young people's needs, really highlights an audit of pathway plans, really highlighted limited attention to emotional and mental ill health in spite of our awareness of high prevalence of need in this respect and the likelihood that this would worsen during transition. It's a complex area, so you've got lots of organisations involved, wide variations in referral criteria and lack of certainty about what's available as barriers to effective signposting to services and support. We have major challenges in England around the transfer from child and adolescent mental health services to adult services, high thresholds for support, different service models, and actually that change in professional relationship can undermine engagement. We also have problems around non-attendance resulting in case closure, meaning young people don't necessarily get access to the support they deserve and need. We also identified challenges around data sharing and confidentiality, which meant that often leaving care personal advisors weren't aware of escalating health needs, so couldn't intervene to support young people in the way that would be desirable. So during the pandemic, the managers we interviewed identified mental health as their most pressing issue and concern by virtue of reduced access at a time of heightened need. And we found that just over a quarter of our samples had strength and difficulty score in the high range of concern, and a further 11% were in the borderline range. So there's a series of quotes now from young people who participated in the study about what it was like for them and their emotional mental health in the context of COVID. So Harry speaks of his fear and anxiety about leaving home. It was very restricting, and it didn't help when you yourself had a restricted mind and you're restricting what you believe you could do. I didn't believe I could leave the front door or the back door because of I thought I was going to hurt myself because of how severe the anxiety was, how much it was ruining my body. Similarly, Amelia experienced low mood due to the kind of isolation and lack of access to her family and friends as support networks. So one of the worst things was definitely being trapped in your own home. I think it was the complete feeling of isolation, feeling like you were trapped in the space that you were in. I did struggle with my emotions a lot, and I started to get quite down. I was just isolating myself in my room when I wanted to escape, curled up in a room in a ball. And there are particular barriers to access to mental health support for this group that I think we really need to be attuned to. I think there are sometimes assumptions about people's technical skills and IT skills alongside digital poverty that mean access to virtual appointments can be really difficult. The realities of poverty in the lives of this group are also a major concern. So the costs of telephone appointments or getting to appointments being a barrier to access. Also, given the relational changes this group experience, there was that real sense of impersonal delivery and not wanting to retell your story to therapists that you've never met. Similarly, issues around lack of confidentiality and psychologically safe spaces for young people to attend appointments. So, for example, one leaving care personal advisor was reflecting that a young person they were working with wasn't able to be honest about the challenges of his mother's mental ill health because she was in the next room. So he just totally disengaged with access to that support because he couldn't speak openly and honestly about what was going on for him. So Hamid speaks of these issues around and challenges the assumption that young people are always IT literate. He said, well, when it moved on to Microsoft Teams, it's a massive change. I'm not technological at all. I know the basics, but I really struggle beyond that. And I wasn't able to physically see my therapist, and it was really difficult to speak through a screen. I couldn't process it. I just couldn't understand how that was meant to actually help. How was that meant to be the equivalent to speaking to someone face to face? Again, I'm not going to read these quotes out, but I think they really just speak to the realities and the challenges for these young people around the issues. So a leaving care manager also, it was really clear there was an absolute commitment from leaving care personal advisors and from managers to facilitate access to support, but real struggles around actually doing that. So one of the leaving care managers really speaks to that. So then we had another young person who hit mental health crisis, and just trying to get him the help he needed was absolutely horrendous. He found himself homeless on the streets, and it just felt like every door we knocked on was a knockback. Eventually we managed to get him an assessment under the Care Act for his mental health, and he was sectioned, and we're working now to try and develop a discharge plan for him. But it's been a long road, and it took a lot of effort on our part to keep taking him back to the outreach services so that he would actually get a service. It took a hell of a lot of effort. We're talking months worth. I think it really just speaks to the importance of the availability of these services. And as I say, there was an absolute commitment from workers to trying to fight for these young people in the way any parent would, but enduring challenges with that.
Emily, I'm wondering if we could just go to a couple of comments or questions.
Yes, by all means.
We might do that to break it up a little bit. I'm just thinking, one of my department colleagues you might have met actually in one of your meetings, Catherine Gibson, has talked about exploring the supported lodgings idea, which is clearly a feature of the UK system. And your comments about that, what's it like? Does it work? Is it something, now you know Australia quite well, you've been here quite a bit, should it be a feature of our system? If so,
I missed which bit of the system, Debs?
The supported lodgings idea.
Yes, happy to. I'm glad I've got that bit. Yes. So to say a bit about supported lodgings. So supported lodgings is host families who have a spare room and are willing to provide and open that up to a young person and to support them with independent skills. And there were some really positive messages about and a value almost in it being outside the care system. So these were young people who often had low expectations of being in a family environment, hadn't necessarily felt the sense of belonging you would have wanted in the foster care system. And they'd found kind of a late family and family living arrangement that really worked for them. So that was, yes, really positive in terms of that. It's an under-researched area, and I think an area that really warrants further exploration, but some really lovely messages about that and the value that that had for young people.
Thanks, Emily. I might let you keep going.
Okay, do interject again if you want to, Debs. So I think really challenging messages, I think, from young people about what didn't necessarily work, but that recognition in terms of service delivery of the importance of taking a relational approach, and concerns that sometimes trauma is misdiagnosed or misrepresented and interpreted by professionals. So if we don't put care leavers' emotional or mental health needs at the centre of all the care planning, we're not going to get very far. If you think about what the emotional skills it takes to connect with an employer, to manage yourself in an interview, to look after your tenancy, to speak to people, all of it requires an ability to regulate. If you're struggling to regulate your emotions or you're in trauma, how do you function in all those aspects? Just focusing on, have you paid the bills? Have you got a job? Are you going to college is redundant if they can't regulate themselves or they're in distress. And local authorities have got very different responses and there were wide variations in the availability of support and services. But there are some really positive specialist provisions that some local authorities have been working to develop, with an emphasis on partnership working between children's social care and health, and an emphasis on that relational approach and sensitivity to the particular needs and circumstances of this group. So you can see those listed below, but I'll just kind of highlight a couple. So the Care Leaver Health Hubs, offering a one-stop shop to support the health of care leavers, including primary mental health workers, nurses and social workers. And really positively proactive work with young mothers and parents and parenting groups and infant massage. Similarly, in some areas, there's been a recognition of the value of services up to 25, so that young people aren't having to negotiate changes in their health provision at the same time that they're negotiating the transition to adulthood and move from foster or residential care into adulthood. And shall we move? That's correct. So this just kind of provides an overview of the in-depth qualitative sample and how young people were getting on. And I think it really speaks to the variation in experience and builds on Mike Steen's work around the different outcome groups. It also speaks to how decision-making in care shapes transition pathways. So the moving on group had really benefited from stability in care, had gradual preparation and planning, and were in education or satisfying jobs, and had really positive and enduring relationships. So that sense of belonging and connectedness to their former carers. And whilst they experienced challenges, as we all did in the context of COVID, that hadn't derailed their plans and aspirations. For the surviving group, there was greater instability during their time in care. They often experienced unplanned and early moves from the system and were engaged in short-term jobs or unemployed. And also, understandably, in the context of past experiences, there was a tendency towards survivalist self-reliance. I can't necessarily rely on other people, so I'm reluctant to seek help and support, which I think is something it's important to be attuned to in working with this group. And for that group, COVID really heightened precarity in their lives. For the struggling group, this was the group who typically experienced multiple placement moves, abrupt transitions from care, and were still battling with isolation, unemployment, and mental health difficulties, and really had to focus on here and now decision making. So the notion of long-term planning was really challenging and problematic for this group. And I just thought I would end with some of the messages that care leavers provided for other care leavers, and you can kind of look at those in a bit more detail going forward. And similarly, I think there's a number of messages to the big boss of children's services, so that's a call to action for those in that space. And if we just move on a couple of slides, I will come into land. Just onto the next one, thanks. I thought I would just highlight, this isn't work that I've directly been engaged in, but I think it's a really lovely project that's been going on in England for a number of years now, which is the Bright Spots programme, which was developed by Julie Selwyn in collaboration with Claire Baker, and really central to that's co-production with young people. And that programme of work explores how children in care and care leavers feel about their lives. They've now got the voices of 20,000 young people. And if we just move to the final slide, I think it's really helpful that actually we often get very fixated on specific hard outcomes, which aren't necessarily that meaningful to young people. So are you in education, employment and training, and have you met normative expectations of that? And I think these indicators are really nice in terms of recognising what's important to young people. Claire Baker is flying in, I think, to Sydney tomorrow, and I know that she's doing an open network event shortly, so she'll be able to tell you a little more about that if you're interested, and I'm sure we can circulate details of when that's going to be. And I will leave it there. Thank you.
You're on mute, Deb.
Thank you, Paul.
Just thought I'd bang in with some co-facilitation.
I just wonder whether we can get some. I know Helen's with us from Monash. We've got Paul here, obviously myself. I might just start by saying a couple of things. I just want to say, Paul, Dylan Langley's on the call. The great Dylan Langley, who worked with Paul on Homestretch, is on this call, and want to acknowledge him. Can I see a thumbs up from you, Dylan?
Yeah.
Young man.
Go you, big. Yeah.
Really.
Good to see you, Dylan.
And also Lisa Griffiths, the chair of the Centre Board. I just want to acknowledge that there's lots of other wonderful people from the department on this call as well. But while we give people some time to think, because there was a lot in that presentation, I've been at other sessions with you, seen even more slides, so I don't know quite how you narrowed them down to what we have there. But can we just talk a little bit about the sort of comparisons? I had the luxury of sitting with you and colleagues yesterday. I mean, the pressure on the system in the UK about the availability of services for young people. We have that issue here as well. And I think we even talked about the uptake of extended care with foster carers. And was there an issue in that? Was there enough foster carers? So was that is that a problem for you as well? Can we just talk about the demand on the system there and then impact on the stay put model, because I think we've got a good model here. We're pretty proud of it.
It's a good model.
It's a bloody good model. But, you know, over time, number one, we will end up with some pressure from the system. But number two, your presentation indicates that we've all got to do a whole lot better around health and education. So can I get you some comments on there, and then I'll maybe get Paul to ask something as well.
Yeah, so the recruitment and retention of foster carers is a massive challenge for us. And there are those tensions and realities in the system of actually, if young people are staying longer, how are we housing those who are coming in? And I think there's a real need for long-term planning and understanding the similarities and differences in need and where young people want to go and at what stage, so that we're building it in. But I think we need to recognise that it should be the norm that you have the right to stay beyond 18. But I think there's space to think creatively about what foster care looks like and how that evolves in the context of changes in the world and in people's lives.
That's fantastic. Paul, any comments from you?
I mean, Emily's presentation raises a couple things, and in another session in the dialogue, I'll just say to all of our listeners and observers or audience on the webinar, sometimes I ask myself, are we making too much of this transition? Are we making, like how the system sometimes segments up in care, transition out of care, or, teenagehood, but we as a system, 15 to 18, 18 to 21, 21 to 25, sometimes as custodians of the system rather than of an individual life who's growing up, we tend to sort of segment these sections. And I think some of the commentary that Emily's saying and some of the thoughts I have, and some of the things that Homestretch we're trying to get to, but still the system's going, is trying to make this normative, trying to make this evolving, not make it a big deal. A young person growing up through 17, 18, 19, 20, 21, 22 should not be a big deal like, oh, you have now reached your 18th birthday, apart from having a freaking bloody good party. And I had a few of those at my house, and I tell you what, none of them are ready for extended care, but don't worry about that. But, we remind them when they're stopping and when they're starting with the system. And one of our challenges is how we present ourselves as a system fairly seamlessly through. So one of the things that Homestretch says is, well, it's up to 21 now. So great, we've taken that, but yet we've got some housing issues. And how do we make it quite normative by docking in the housing issues with this reform, the housing stock? Emily's suggestion of supported housing or whatever it was called was an interesting concept, I say, and we saw that with the boat arrivals. If we all remember the boat arrivals, there were particular parts of the community going, putting up their hand saying, I'll take this crew, I'll put them in there, I've got a spare bedroom, and we've seen stories of those lucky ones who went to bedrooms and remained great tenants within those homes. And I think that's an interesting one to maybe pitch this group to, that sort of interdependent, as you say, Emily, housing sort of architecture. So my comment, Deb, and is how we just continue to, deconstruct the segments of the system to actually, what does a normal young person want? Well, they want a house, they want to maybe go to study, they want to know there's an adult around who they can pitch off, who can go home and clean the lawn, all of that. And just remind ourselves through Emily's that's where we're trying to get to as we introduce these reforms, and still a way to go.
Yeah, no, I think it's so important that we do tend to chop up the system, and I've really been speaking to actually thinking about a life course perspective rather than those segmented and service-driven changes, which aren't actually helpful for young people. I think one of the other things we need to be much more attuned to is actually helping young people build lifelong links that endure and aren't time limited. So there's a project in England which has really been intentional about supporting young people to develop informal networks amongst their family, which will continue throughout their time in care, rather than thinking about replacing that almost with the formal leaving care PA, that you actually need to be building that bridging capital in a much more normative way, in the same way we do for our own children. Yeah.
There's some stuff coming up in the chat specifically around their health stuff, and I'm going to get Emily and Helen to respond to this, because we've got Judith Scarf commenting on, it is really challenging to get young people to access what is available, and I wonder whether that's about what's available. And then we've got the wonderful Karen McLean, who's been researching in this area for a very long time, has done some exceptional work, who says it seems as though the UK is ahead of us here in terms of managing health for children and young people in care. For example, we've designated doctors and nurses, and she is one of them. I mean, you know, we all send our kids there. Do you think we need to sort that out first before we're likely to succeed in young people aging out of the? I mean, very interesting comment that Karen makes. So, Helen, you might want to start us off here, because
thank you. Yeah, and you know, I love Karen's work too, so it's lovely to hear from Karen. But all those comments are really topical and on point. You know, I'm obviously a researcher at Monash University. I have been researching in this space for a very long time, but I don't have that frontline experience. But what I do know as a researcher, what I have seen is that there are industry challenges that prevent the transformation that we need here. This is transformational stuff. It's not easy. It's completely complex, right? So in order for transformation to occur, we need to break down the silos, and we're already hearing about those with people that are coming from health, saying that these young people are not being able to access health. And yet, you know, the speakers today and many of us on the call will probably be from community services, I'm just guessing, or from departments. And when I do other talks and webinars that are more focused on medical issues, you know, everyone's from health, and I'm the lone voice saying, where are community child and welfare in this discussion about children and young people who are living with most disadvantage? So that's the one thing we've got to break down, sectoral silos. We have a crisis-driven response. We lack prevention, and we have to flip it on its head. We have to try and push prevention into this space. Not easy, but that's what we have to aim for. And what's really important for me as a researcher is that we have limited skills. This is not an indictment or a criticism of the sector, but we have limited skills, and researchers as well, on how to develop, adapt and implement and evaluate programs to enable them to work at scale. So what we're constantly doing is literally taking programs off the shelf, embedding them, they don't work, then we go to another program, we embed that, they don't work. We've got to stop that cycle, and we've got to really think about how we innovate through implementation science, completely different science, to push our evidence of what we know works. So we all know what works. We could probably just tell each other what works, just like seeing a doctor and receiving the medical care that's needed, we know will work, but it's not happening. So implementation science helps us understand the barriers and enablers and helps us move out of that valley of death and into sustainable outcomes. So that's my researcher
You're talking
spiel.
There'll be people on this call, and I know Paul's the same, who've been implementing evidence-based models in this sector, and we've got open a range of other activities that we are, like, it's our sweet spot. But I think what you're talking about, Helen, is we don't have the evidence on what works for health services for these children and their families.
That's right, Deb, that's right. And like I said, it's not a criticism. This is actually more about all of us in the tent together. So researchers, practitioners, clinicians, you know, everybody together. We really don't know how to push our evidence into sustainable outcomes. And that's why we're not seeing those really good outcomes. We all know young people personally or through our work that have fallen through the cracks, and they continue to fall in through the cracks. 2023, right? So how do we stop that? Literally, there's not that many of them. How do we stop that from happening? That's the pointy, very difficult end of implementation science.
I think one of the important things for me is being much more proactive about co-design with young people. These young people know what they want and need. We're not delivering it in a way that's accessible. So how do we address that? And I think implementation science, but that co-design, co-production is central to taking that forward.
It's very true. They do know what they need, and we don't always do it. I just want to make, there's some comments in the chat too about, we've got a federated model here in Australia, and so there is, and Jade has made a couple of fantastic comments about supported lodgings might improve better social inclusion for our young people if it was introduced here in Victoria, but also that federal state divide in our health system creates some real problems for the state about making sure care leavers get access to what they need in our bigger federally funded system. So I think that's an important comment. But there's a couple of questions in here too. The first one from Hayley is, what's the name of the project in the UK that's supporting young people to identify enduring informal networks?
So it's Lifelong Links. The Families' Rights Group has got a project around lifelong links.
And the second one is, how is this transformation relate to cold and African communities? So there's a question for all of us here. Emily, this will be something that's right in the heart of what you have been thinking around your research in terms of the diversity of the young people that are into care services in the UK. And for you, Helen, and you, Paul, how do we make sure that we've not just got a diverse workforce, but that we're responding to young people from diverse backgrounds? Emily, do you want to start?
Well, I think it's being attuned to that and ensuring that those groups have a real voice. I think there's sometimes the danger in our participatory work that we work with a narrow group of brilliant and highly articulate young people, but we don't get the diversity of experience and the cultural diversity that we need to ensure services are tailored. And I think that's something we need to be proactive on working on and developing, but really important.
Yeah, I agree. Any other comments from Helen or Paul in relation to that?
Well, I'll say, look, as an employer of residential staff, I'd say 75% of my residential staff would be from a cold background.
Yeah.
We are attracting some fantastic staff from very diverse and rich backgrounds into these homes because they love working in them, and they bring this fantastic, if I could say, cultural approach into creating resi units into family homes. So, or homes that young people can fill. So I think it's a good question. The transformation bit is, how do you get that richness transforming up into sort of informing policy? And I still, I think we're still in the early stages. How do we engage with communities, African communities and cold communities around vulnerable young people, and how to help them successfully make their way through Australian life? I still think we haven't really sort of, assertively pushed ourselves that way. The second one is, I'll make a comment that, at the end of the day, we're parents. We may be the corporate parent, but parent we are. And I think but parent being we, delegated to, but the state is the parent. Yet remarkably, the state has maybe legislatively delegated some of the management of the child to a department. What's always struck me odd is this is the only group under the legal guardianship of the government. Why wouldn't they share the largesse in mental health? Why wouldn't they be prioritising housing? Why wouldn't they be prioritising education as a cohort? I see that the cohort's small compared to large cohorts of school attenders or people coming into hospitals, but they're in a special queue of their own because this is the group the state is legally responsible for and now seeing them through to 21. So I think we've got a bit of a way to go of getting systems somehow more sort of obligated to respond to this group. And Helen's right in her commentary about health and this group and who, what, oh, well, we've got others. Well, in fact, how do we say, well, this group is under the legal care or, under the legal responsibility, obligation up to 21 now of the state? How do we move them up the front to mental health services and having a system worried about them? It struck me that you'd had to do a word search in the Royal Commission on Mental Health that we just had. Now, my bet, I think out of home care got mentioned twice. Now, not just saying. I would have had a bloody chapter on it if I was running from the state of mental health system and this cohort, just because of the legal obligation around this cohort. Yeah. Again, with housing, it's the same. So whilst many of the members, and I call out Catherine Gibson and her team, have really just actually developed a leading extended care program that is internationally being talked about here in Victoria, the sibling departments and the way the state views those sibling departments in their obligations to the child has got a way to go. I'd say there'd be some of my comments.
Totally agree, Paul, and I think you're right. Raise these issues with the minister around, you know, the lack of access to the mental health reforms as just one example. There's some big reforms going on in Victoria, but getting this group, I think, their own queue, which is to be at the front of the queue, is not really has not really happened. Now we are at 1 o'clock. And so I'm going to be vicious in terms of cutting us off here, because most of us could continue the whole day talking about this. I just want to thank Helen for sponsoring Emily to come over and for the wonderful opportunity to work so closely with you and Emily on her visit. I'm hoping to see Emily later in the year when I get over there. And as I keep saying, we're from the same part of the world, and so that's all just gorgeous. I do want to thank Paul for helping us align what's on in Victoria in terms of extending care and your work, Emily, but actually we know it's a platform where we can do so much better and so much more. And I think of what Paul's described and Helen's described, to make sure that those big mainstream systems, we bring them to bear, bring them to account to make sure these kids get what they need when they need it, I think is the challenge in front of us. I think it's doable. I think it has to be done. So I'm going to end us all on that note. Happy International Women's Day, everybody, and enjoy the rest of the day. Think about your mum, think about your daughters, think about your granddaughters. And I've got a new granddaughter, and I really hope some of the things that we've been fighting for a long time come to fruition for the little girls that are born today. Take care, everybody, and thank you so much for coming along. This has been recorded, so for those who didn't get along, they will be able to play it back in their own time. Thank you, everybody.
Thanks, Deb. Thanks, everyone.
Bye. Bye.
Thanks, everybody. Thanks, Emily.
No problem, that's great.